Okay. Okay. Start.
Hello.
Hello, good
Hello, I'm
afternoon,
Dr.
doctor.
Good afternoon. I'm Dr. Musarat, and I'm here to discuss with you about your recent diagnosis and further plan. So, before starting, may I ask your name, please?
My name is Henna.
Henna. Okay. All right. So, Henna, I have seen in your notes that you have been recently diagnosed with emphysema, and I am here to discuss with you about the condition and then further plans. But before that, I want to know from your side, what are your concerns and what do you expect from me today?
I do not know about this condition, doctor. Could you please tell me or explain me this condition, doctor?
Okay, all right. So, Henna, this is, have you ever heard about this word, emphysema?
Yes, doctor, because my father also had the same thing, and what I understand
Mhm.
is that it's related to smoking, and I'm very much guilty about that. I smoke, and I smoked for around 25 years. So could you please tell me,
Mhm.
doctor, about this condition?
Yeah, I can understand, Hannah, that it's a chronic condition, and don't need to be feel that it's your fault or you have done something wrong. This condition is common, and there are ways to control it, and I will discuss all those options with you. Okay. So coming towards your question, that what is this condition? So this is emphysema meant, like, it means that there is some excess air getting trapped inside your lungs because of maybe your airways become narrow and air cannot get released easily, so it's getting trapped. And once the air gets trapped inside the lungs, you know, it becomes a cycle, and there are the problems which you are facing, like breathing problems, and on the top of that there are infections. So this will be a kind of vicious circle, and we will call it as a chronic lung condition. Am I
Well,
clear so far?
yes, doctor. Doctor, is there anything that can be done to make this exhaling easier? Why
Yeah.
can't this air get out?
Yeah, okay. So Hannah, I will come to that point. So there are many ways, many options to discuss with you. There are some conservative measures, some lifestyle measures, and then I will prescribe you some medications also to optimize your condition. And then the last resort, we will also discuss about surgery if you want. So do you want me to discuss all those options, or you have any other question for me at the moment?
Well, doctor, you know what? You know, uh, I just wanted to know that about this physiotherapy. What physiotherapy could do, and is it likely to extend my life?
Okay, well, so physiotherapy it is one of the first options which you will start doing, and it's according to different patients and according to different research, it's very helpful strategy in your condition. Actually, we call it as a breathing exercises, and these exercises will actually release air from the lungs, and it will make your condition, like, it will improve your condition. I will connect you with some professional breathing technique physiotherapist who will guide you to how to do it, and you will feel, once you will start it with the regular sessions, you will feel better. Your symptoms will gradually improve. Okay. And along with that, Hina, as you told me that you have been smoking for past 25 years, so it's very important if you think over, like, quitting the smoking, because smoking is injurious for the airways and for your lung health of your lungs. So have you ever thought about it, or like, you will be following for it in the future just to control your condition?
Well, doctor, I will try to do that. But doctor, could you please discuss with me the possible surgical options?
Okay, well, so after all these conservative measures, the surgical option would be, this is a last resort, Hina. If medications and conservative measures will not do work and your condition will deteriorate, then maybe your health physician will advise you about the last resort, that is surgical option. In surgery, basically they will remove some part of the lung. We call it as a lung reduction, and they will put you on some medication, some chronic steroids and some antibiotics to overcome the infection, and then they will see. But the thing is that no procedure is without risk. So it is really, I will emphasize you to I will provide you some printouts as well, so that you can read that there are risks and benefits both associated with surgery. So, and as I told you that this is a last resort, so if the benefits will be more, then only we will give you a surgical option. Before that, we will try to control this condition with the medication and help of the conservative measures. Do you have
Well, okay,
yeah.
doctor. And doctor, can you please tell me what can be done to prevent frequent infections?
Okay, so Hina, this condition is very likely associated with infections, because air is trapped inside the lungs, and this is a common place for the bacteria to come and to gather there. So we will put you on antibiotics, probably a short and long course, and these antibiotics will eventually not leading you towards the infection caused by those bacterias.
Yeah, okay, doctor. And doctor, you know what? Uh, why I feel responsible of getting this emphysema? I don't know what to do, doctor. It's all my fault, doctor, that I got this disease.
Henna, as I told you, it's nothing that you have done something wrong. Just the thing is that you need to just optimize your condition, and you need to quit smoking. Maybe smoking could be a factor in this condition. So once the moment you start quitting smoking, the healthy changes will start occurring in your lung. So it is very important. I will connect you with the smoking stop services, and they will help you out in this regard. And it's not your fault at all. It's just a cause of this condition, and once you will stop smoking, things will get better with the time, and with along with the medications also, which I will give you today. Am I
Okay,
clear so
doctor.
far?
Yes, doctor.
Hmm. Do you have any more questions?
No, doctor.
So is it okay if I will make a plan for you today, and I will prescribe some medications? These are
Yes,
like
doctor.
steroid and some other antibiotics. And after that, I will connect you with the services to start your conservative measures like physiotherapy and smoking quit. And then we will keep you under follow up. Would that be okay for you?
Yes, doctor.
Okay. Thank you.
Okay,
So
thank you,
is it
doctor.
done or?
Yes. Okay, anyone else want to do? Anyone else? If anyone wants to do this card, then just start preparing. Okay, Sabine, it was a very good attempt, I would say, but I think you were doing this card in a context of giving a plab, or just giving a NAC or ski or something. Maybe you have a background of that. You were using too much of your medical knowledge. Okay, so
Okay.
you don't have to use that much of medical knowledge. And
Okay.
in OET also, the officials also say that you don't have to use the medical knowledge, you have to use your English. You have to show your
Hmm.
fluency. Moreover, there was no empathy, and there was no reassurance in your something like that. Just in the end also, try to allay the patient's feeling of guilt. And you were like that it's nothing to do with you, and it's just because of smoking, and you just quit smoking. So your introduction, your everything was good. Okay,
Okay.
everything was good, your English is good. There were really, there was any kind of a grammatical mistakes, I must say. And but you what you were doing was that you were just
Hmm.
jumping from one task to another task, and you were
Okay.
not letting me to ask the questions. So
Okay.
always just try to do one task. And if you think that for example, if the task number 2, if I will see, prescribe appropriate bronchodilators and a steroid, and then
Hmm.
recommend this, these two tasks can be done simultaneously, or both together can be done. Okay, it can be done together. So these kind of tasks you can do it together. But when the task is okay, fine, you have to explain something, that you can do
Hmm.
it separately. Now if say this is setting is this, and it's the suburban clinic, and the patient is this patient has been recently diagnosed with emphysema. So
Hmm.
uh, with this introduction you don't get to know that okay fine the patient has come to you before as well or not, or you are seeing the patient for the very first time, because it's written, you don't know about that. Maybe
Okay.
some specialist diagnosed him with emphysema, okay, and now he
Okay.
is with you, or
Yeah.
something like that. So this is the background. And if you're going to take this background with you,
Mm.
then you,
Mm.
if you're just you know what what I will say, that if you're just thinking that okay fine, I'm a GP and this patient is coming to my clinic for the second time, then you must have known about the family history as well. Then you would
Yeah.
not be
Yeah.
asking me, okay, that because the
Mm.
GP has all the information. So your introduction was also good, but you can do it with the first visit or something like that. Okay, fine, okay. Then the patient will say, okay, fine, okay. I know I have been diagnosed with emphysema, and I
Mm.
just wanted to know. Then you will just be empathic. Oh, I'm so sorry to hear about this. I understand it must be very, a shocking news, or it
Yeah.
must
Yeah.
be very frustrating or
Mm.
a stressful situation for you. But I'm here to help you, and I will just explain you about this. Then you just explain the emphysema. Okay, instead of asking okay why this, okay fine, have you heard about this term? No. If I'm just saying
No.
okay fine, okay, then
Mm.
just
Mm.
explain it. And just okay
Mm.
fine, ticket, it's the air trapping and all this, you explain it.
Yeah.
Then I was just saying that okay, is there anything that can be done to make my exhaling easier? Okay,
Yeah.
so instead of that, you were like, you just gave me a full explanation of three to
I
four
know.
sentences. You can just
Okay.
make it, just add a reassuring sentence. Okay, I understand it must be very difficult for you to exhale. And what
Mm.
usually happens is in emphysema, the air gets trapped because we don't have that
Mm.
much of collagen that
Mm.
expels there. But to reduce this difficulty in your in your breathing, or to alleviate your breathing, what I alleviate
Mm.
difficulty in your breathing, something like that, I can
Yeah.
prescribe you bronchodilators and steroid inhalers. Apart from that, I would also like to recommend you chest physiotherapy. It has been proven very efficient. And in this, I would just refer you to a chest your physiotherapist, and they will teach you some kind of breathing techniques and this that, and it will just help you do that. And the do's and don't, you just explain that.
Okay.
Okay,
Okay.
instead of just giving everything from a
So, so
yes.
Dr. Hina, should I wait for your question or I will just keep saying? I
See, it's very good. You have to wait for my questions. Now,
okay.
did you notice that? Okay, fine. In the end, you just
Huh.
told me everything about this antibiotics and this that, and
Yeah,
I
everything.
also asked you, okay, how to reduce the infection, and that
Yeah.
thing you just explained me. I will do my card according to I will do my task. I will not see that. Okay, fine, whether you have performed or not. I will just read these questions. And in the examiner will just read these questions despite you have done it, you have given the answer or something like that. I will just repeat it. And what happens when the question just comes, the same question comes arises again? Okay, fine, what about the infection? Then most of the candidates do get confused that okay, fine, abhi to maine, I just told him, sorry, yeah, the net get disconnected, got so okay. So I will just start again. So, that you were saying that, okay, fine, if I just go from one question to another, no, I will do my task according to this. So you have to follow this template. Moreover, do not, add medical knowledge. Just do it as the
Okay.
card goes, and everything according to the card. And just be confident,
Okay.
and use empathic sentences as well. That's very important.
Okay.
And then,
Empathy and one
then,
more question, Dr.
yes.
Hina. Sorry, I will interrupt you. Like after answering, I will stop and then you will ask me the next question. It will be like that?
Yes, you will say, okay, fine. Yes, you will say, okay, fine. Do you have any other further
Okay.
concerns, or is there
Yes,
anything
yes.
else that is bothering you? I will. You can just ask these
Mm.
kind of questions. So I just speak up.
Yeah, English.
If even
Yeah,
if I'm
speak
not
up.
speaking, that okay, fine. If for
Anything.
example, I just told you that ask the doctor about physiotherapy could do something, so then you will
Hmm.
just okay, fine, okay, physical physiotherapy will do this. And if I'm just
Hmm.
if I'm not and you have done your task, and I'm not saying anything else, then what you will say, okay, fine, now let me discuss with you some surgical options. How does this sound to you? You
Option.
will ask me, okay,
Mhm.
yeah, but I would like to and one line you were repeating again and again was that okay, fine, surgery is the last option, surgery is the last
Oh
resort,
yeah.
surgery is this.
No.
Don't make this
Yeah.
kind of repetitions
Don't
again
repeat.
and again.
Yeah.
Yes,
Mm-hmm.
because even
Okay.
if you're even if you're in doing flab or something, you will not repeat
I
this.
know. Yeah.
You just
Yeah.
say
No
it
repeat.
once or twice, that's it. And again,
Okay.
the whatever is age and condition and everything. And yes, and quitting smoking, that okay fine. And in the end, the last task, okay, the feeling of that
How?
was only and only for the reassurance, empathy and sympathy, that's it. I understand, but it's not your fault, it's because of smoking, but still you have time, you are young, or whatever. If I've just told you my age, okay fine, you can do it. There's nothing to be worried about. Even if you do not smoke, many people do have this condition. And but it's
Mm,
I'm glad that you're here, and you are here to seek help.
yeah.
Okay, you will just make these
Hmm.
kind of sentences, you will just make him
Yeah. Yeah.
feel better. And you will say, okay
Yeah.
fine, we are here to help you, we have a team of doctors, do not worry. I'm here to help you with everything. And in the end also, you can give some kind of a leaflet, that okay fine,
Yeah. Yeah.
these are
Yeah.
some kind of a breathing exercise that you can do it. Okay, these are some of the methods. Okay, or you can just tell him,
Yeah.
okay fine, I understand that quitting smoking is very difficult for you, but there are many alternate ways. You can start with nicotine gums. Okay, you should have a strong willpower. And now, as you are just feeling, but I will say that okay fine, do not feel sad or depressed. Okay, now you have time, you can
Yeah.
just improve your condition, something that you just just motivate that patient, you will encourage that patient.
Okay. Okay.
Okay, instead of saying okay fine, you just quit smoking, no.
Hmm.
And in the end
Hmm.
of the card also, you want you can give a leaflet about emphysema or smoking, anything if you want.
Okay. Okay.
Okay, anyone else want to do this card? Anyone else? Or anyone else have any question related to speaking? Anyone? Okay, so since nobody wants to do, so I'll just end this meeting, and inshallah then tomorrow, I will just let you know about the writing. The letter was sent me in the group about Santini, Miss Santini something, and it was a difficult task, so we will just do the writing of that task, and we will do it together. I will inform you about the time in the group. Okay.
Okay.
So then,
All
if you
right.
have
Thank you,
any
Dr. Hina.
question, you can just ask in the group.
Okay. Thank you, Dr. Hina. Thank you so much.
Thank you.
Bye.